I think it's pretty exciting when you have two phase 3 studies in MDS that have positive results confirming benefit of an investigational agent. When thinking about the number of positive phase 3 studies in MDS, my colleague Dr. Zaidan at ASCO put it very nicely, where you can count them on one hand, more or less. So having the COMMANDS study data, which confirmed the benefit of luspatercept in ESA naive, EPO lower risk MDS with anemia versus EPO alpha is quite exciting. And by that same token, in a space that even is maybe a little murkier is what to do in lower risk MDS with previous ESA exposure. And the IMerge study, which was presented by Dr. Zaidan, confirmed the benefit of the telomerase inhibitor imetelstat versus placebo in this patient population. So we now have two positive phase 3 studies in lower risk MDS with anemia. And that's pretty exciting in the myeloid space. I think having those sorts of advances in the MDS space and all kind of being presented for the first time in the context of one conference is incredibly invigorating. These are the sorts of trials that really can impact the treatment paradigm. And certainly there are questions that remain open even after interpreting these phase 3 studies. For example, when thinking about the COMMANDS data, one question that comes to mind is whether luspatercept should be used over ESA in those patients that are ring sideroblast negative. When thinking about the results of the IMerge study, imetelstat versus placebo, most patients did not have previous luspatercept exposure, and we don't really know, what the efficacy of imetelstat may be in a luspatercept exposed population. So if you kind of layer the two studies upon each other, you can see that as the treatment paradigm shifts, more and more questions arise. But overall, we've seen two positive studies in the MDS space, and that's incredibly exciting to happen at any one conference. So seeing that splash in myeloid malignancies is incredibly exciting.